Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
You ever get that feeling like a little hesitation when you need to use the bathroom? Or maybe a bit more urgency,
Yes.
especially as we get older.
Yeah.
Well, for a lot of men, this could actually be a sign of an enlarged prostate.
Right.
Doctors call it benign prostatic hyperplasia.
Mm-hmm.
It's super common. And even though it's not cancerous, it can still be like really annoying, right?
Oh, yeah. Absolutely.
So today, we're going to dive into some surgical options for dealing with this.
Okay.
And the cool thing is, these surgeries not only try to relieve those like frustrating urinary symptoms,
Right.
but they also really focus on, well, maintaining something that's super important to a lot of men, their sexual function.
Absolutely. Yeah.
Yeah.
We're going to be taking a close look at two pretty promising surgical treatments for benign prostatic hyperplasia.
Okay.
First up, we've got aquablation.
Okay.
It's a newer technique that uses a super precise water jet.
Interesting.
And then we'll talk about holmium laser enucleation of the prostate,
Okay.
which is often just called HoLEP for short.
Yeah.
We're going to break down what the scientific evidence tells us about how these two procedures stack up against each other, especially for guys who are dealing with an enlarged prostate.
Yeah, and to do this deep dive, we're mainly going off of a study that was published in the World Journal of Urology back in May of 2024. It directly compared these two procedures.
Right.
But we're also going to be looking at some cool findings from something called the WATER 3 trial, which was presented at the European Association of Urology Congress in 2025.
Yeah.
So we've got a nice collection of sources here to paint a full picture.
Yeah, definitely.
And our goal here for you, the listener, is to lay out these surgical options in simple terms.
Wow.
You know, no matter if you're going through this yourself, maybe you're trying to learn for someone you care about, or you just like to know what's going on, right?
Yeah, absolutely.
We want to highlight the key differences between these procedures. How well do they actually work? What about the potential side effects? We really want you to walk away understanding what these findings might mean for guys who are dealing with this super common problem.
Absolutely. Yeah, that's the goal, to break it down in a way that everyone can understand and really make it useful for people.
Okay, so let's kick things off with that 2024 study you mentioned. What was the main thing the researchers were trying to figure out with this?
Well, the big question was, how do the outcomes of these two procedures compare?
Okay.
They wanted to see how men who had aquablation did compared to men who had HoLEP, in terms of dealing with their benign prostatic hyperplasia.
Okay.
And to do that, they looked at a pretty wide range of results to really get the full picture.
Okay, so how did they go about comparing those two groups? What did the research actually involve?
Well, they did what's called a prospective non-randomized study.
Mm-hmm.
What that means is they followed the patients forward in time to see how they did after surgery. But the choice of which surgery a patient actually got wasn't like randomly decided by the researchers. It was more about what the patient and their doctor thought was best after talking about the options.
Makes sense.
The study had 40 men in total. 16 of them had aquablation and 24 had the HoLEP procedure.
Got it. And what exactly were they measuring in these guys, both before and after the surgery?
They looked at a ton of stuff. Before the surgery, and then again 3 months, 6 months, and 12 months afterwards, they measured the actual size of the prostate gland itself. They also checked some basic lab tests, measured how much urine was left in the bladder after someone peed. That's called the post-void residual volume. And they looked at how fast the urine was flowing out.
It sounds pretty thorough.
Oh yeah, and that's not even all of it. They also used some questionnaires to get the patient's perspective. These questionnaires were designed to figure out how bad their urinary symptoms were, whether they were having any problems with, accidentally leaking urine, what we call incontinence, how well they were able to, get and keep an erection, whether they could ejaculate, and how satisfied they were overall with the treatment they got.
Wow, so they really covered all the bases. Did they also track what happened during the surgeries themselves?
Yeah, you bet they did. They analyzed things like how long the operation took and whether there were any complications during or right after the surgery.
Okay.
They even used this system called the Clavian-Dindo classification to rate how serious any complications were, from little things to bigger problems that needed more attention.
So they really were like paying close attention to every detail.
Yeah, definitely.
So after going through all that data, what were some of the main takeaways from the 2024 study? What did they find out?
Well, a few things really stood out. First off, they found that the HoLEP procedure was usually quicker to do. It took about 60 minutes on average, compared to around 87 minutes for aquablation.
Okay.
Also, HoLEP was better at actually shrinking the prostate. At the 12-month follow-up, the guys who had HoLEP had way less urine left in their bladders after peeing.
So it sounds like HoLEP was faster and better at shrinking the prostate. But what about those potential side effects? Especially the ones that affect sexual function and continence.
That's where things get a little more interesting. It seems like aquablation might have an edge early on. At 3 months after surgery, the men who had aquablation said they had better ejaculatory function and better bladder control than the HoLEP group. But that early advantage didn't seem to stick around. After 3 months, there wasn't much difference between the two groups when it came to erectile function, ejaculatory function, continence, or how much their lower urinary tract symptoms had improved.
So it's kind of a trade-off then.
It seems that way, yeah.
What about the overall safety of the two procedures? Did they see any differences in the types or seriousness of complications?
Yeah, this is important. The study found that more severe complications, the kind that need extra treatment like surgery or procedures under anesthesia, were more common with aquablation. Specifically, 6 patients in the aquablation group had these kinds of complications, while only 1 patient in the HoLEP group did. And the main reason for these tougher complications with aquablation was bleeding after the surgery that needed extra care.
So bleeding was more of an issue with aquablation in this study.
It seems that way, yeah.
That's important for people to know. Now, you mentioned another study earlier, the WATER 3 trial. What was the main focus of that one?
The WATER 3 trial was all about testing aquablation in men with much larger prostates, specifically those between 80 and 180 milliliters. That's bigger than what aquablation has typically been used for before. They compared aquablation to laser surgery, which in this case meant either HoLEP or a similar procedure called thulium laser enucleation of the prostate. And this trial paid close attention to side effects like erectile dysfunction and urinary incontinence.
Interesting. And how did they carry out the WATER 3 trial?
They recruited 202 men who needed surgery for their enlarged prostates, all with prostates in that large size range. About half of them got aquablation and the other half got one of the laser surgeries. Then they checked in with the men 3 months after surgery to see how they were doing.
Makes sense. So what did they find out in the WATER 3 trial? What were the key takeaways?
They found some really interesting things, especially when it came to sexual function. They saw a much lower rate of retrograde ejaculation in the aquablation group. Basically, retrograde ejaculation is when, semen goes backwards into the bladder instead of out through the penis during orgasm.
Right.
Well, only 15% of the sexually active men who had aquablation experienced this, compared to over 75% of the guys who had laser surgery. That's a huge difference. For a lot of men, being able to ejaculate normally is a big part of their sexual satisfaction.
That's a really significant difference. What about urinary incontinence in the WATER 3 trial? Did they see anything interesting there?
Yeah, they actually did. Fewer men in the aquablation group reported having urinary incontinence at the 3-month checkup, only 9% compared to 20% of the guys who had laser surgery. Interestingly, though, both groups saw similar improvements in their urinary symptoms over that short time, and they had about the same rate of other general side effects.
Okay, so let's take a step back and think about what all of this means for men who are dealing with an enlarged prostate. What are the big takeaways from these studies?
The 2024 study suggests that aquablation might be a good choice for men who really want to preserve their ability to ejaculate and have good bladder control, at least in the first 3 months after surgery.
Okay.
But that same study also showed that HoLEP was better at making the prostate smaller. And for some men, that might mean better and longer-lasting relief from their urinary symptoms.
So it really depends on what the individual's priorities are.
Exactly. And the WATER 3 trial really emphasized how aquablation might be better for preserving a man's ability to ejaculate, particularly for guys with larger prostates. This could be really reassuring for men who are worried about how surgery might affect their sex life.
Yeah, that makes sense. It sounds like both surgeries can help with those annoying urinary symptoms, though, right?
Yeah, that's right. Both the 2024 study, when looking at the bigger picture, and the WATER 3 trial showed that both procedures are pretty much equally effective at reducing lower urinary tract symptoms in the short term.
I also remember something about aquablation potentially being easier for surgeons to learn.
Right. Professor Ritter, who worked on the WATER 3 trial, pointed out that it might be quicker for surgeons to get good at doing aquablation compared to laser surgeries like HoLEP. If that's true, it could mean that aquablation becomes more widely available, which would be good news for guys with larger prostates who might not have to wait as long for surgery.
That makes a lot of sense. Now, of course, no study is perfect. What are some limitations we should keep in mind when we're looking at these results?
Absolutely. It's always important to look at the limitations. In the 2024 study, the patients chose which surgery they wanted. So, the two groups might have been different in other ways besides just the surgery they got. For example, the HoLEP group had bigger prostates to begin with, on average, which could have affected the results. The study also only included 40 men, which isn't a ton, so the findings might not apply to all men with this condition. And all the surgeries were done at the same hospital, meaning the surgeon's experience with each procedure might have played a role in the results. In fact, they had more experience with HoLEP than aquablation.
Okay, so that could have skewed things a bit.
Exactly. Plus, with aquablation, they don't always check the removed prostate tissue under a microscope, so they can't always be completely sure that it was benign.
What about limitations for the Water 3 trial? Anything there?
Yeah, they mainly looked at results 3 months after surgery, so we don't know much about the long-term effects of aquablation compared to laser surgery for guys with big prostates. One expert, Professor D'Annunzio, also mentioned that it would be good to include more patients with complicated situations in future studies, like those who can't pee on their own or who need catheters. He also said we need more long-term data on things like prostate-specific antigen levels and urine flow rates to see how these treatments really hold up over time.
It's always good to have more data. What did the experts who worked on these studies have to say about all this?
The researchers who did the 2024 study said that both procedures have their pros and cons. They basically said it's important to have options so doctors can choose the best approach for each patient's needs and goals.
That makes sense. It's not one size fits all.
Right. And Professor Ritter from the Water 3 trial was really excited about aquablation as an alternative to laser surgery, especially for men with bigger prostates. He thinks it has a lot of potential for preserving ejaculatory function. Professor D'Annunzio, who commented on the Water 3 trial, agreed with that. He said that a lot of men are really worried about retrograde ejaculation, and aquablation seems to be a good option for them. But, like we said, he also stressed that we need more research, especially long-term studies, and we need to include a wider range of patients.
So for someone listening who might be experiencing symptoms of an enlarged prostate or thinking about surgery, what's the most important message you want them to take away?
I think the biggest thing to remember is that there's no single best answer for everyone. Deciding between aquablation and HoLEP is about weighing the pros and cons of each procedure based on your individual needs and preferences. The 2024 study showed that aquablation might have the edge when it comes to ejaculatory function and continence early on, but HoLEP seems to do a better job of shrinking the prostate. And the Water 3 trial showed that aquablation is really promising for preserving ejaculatory function in guys with bigger prostates.
So how should someone in that situation go about making a decision?
Talk to your urologist. Have a really open and honest conversation about your symptoms, what you care about most in terms of outcomes and potential side effects, and the specifics of your prostate. Don't be afraid to ask them about their experience with both procedures and to bring up the studies we talked about today. Think about what's most important to you personally. Do you care most about a fast recovery, getting rid of those urinary symptoms, or maintaining your sexual function? And remember, research is always moving forward, so keep yourself informed.
It sounds like there are a lot of exciting developments happening in men's health.
Definitely. As technology keeps getting better, it makes you wonder how these procedures might evolve even further in the future. Maybe we'll see even more personalized and less invasive treatments for benign prostatic hyperplasia, treatments that are even better tailored to each man's needs. It's something to keep an eye on for sure.
Absolutely. Thanks for breaking all of that down for us.
No problem at all. Glad to be here.
And to our listeners, thanks for joining us for this deep dive. We'll catch you next time.
See you then.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.